everyone. This is Kaur, an assistant professor of pharmacology working with RPIIT Technical and Medical Campus, Karnal. Today I am here again with a new video on Covid-19 disease. Covid-19 pandemic in India is a part of worldwide pandemic of coronavirus disease caused by severe acute respiratory syndrome coronavirus 2. The first case of coronavirus disease in India was reported on 30th of January 2020. Currently, India has the largest number of coronavirus positive patients. As of June 2021, India is the country with highest number of coronavirus positive patients and a country with highest number of coronavirus deaths. So here in this video, we will talk about coronavirus, the prevention, diagnosis, treatment, transmission of this disease. So here we go with the video.
Covid-19 stands for Coronavirus Disease 2019, which originated in Wuhan province of China and quickly spread across the world. Corona is a large group of viruses which can infect both humans and animals with cold-related diseases. The intensity of the infection ranges from common cold to acute respiratory syndrome. So the question which comes into our mind is, how long does the virus stay alive on different materials? Virus can stay alive for 4 to 5 days on paper and up to 4 days on wood like chairs and tables. Whereas virus can stay alive for 2 days on metal and for 4 days on glass. On gloves, it can stay alive for 4 to 5 days, whereas on plastic products, coronavirus can stay alive for 5 days. Thus, it is advisable to clean our hands with soap and water before and after using the utensils. It is necessary to keep these household utensils clean as well. Let's talk about the signs and symptoms of coronavirus. The signs and symptoms of coronavirus include fever, cough, fatigue. Person may be pneumonia positive, shortness of breath, vomiting, and diarrhea can also be reported in some of the cases. After being infected, people may carry the virus from a couple of days to 14 days before they start to notice any of these symptoms. The typical symptoms of coronavirus disease are fever, dry cough, fatigue, sputum production, shortness of breath, myalgia or arthralgia, that means muscle pain and joint pain respectively, sore throat, headache, chills, nausea, vomiting, muscle congestion, diarrhea, hemoptysis, and conjunctival congestion. So what are the diagnostic measures? Suspected cases are screened for coronavirus disease with NAT, that is nucleic acid amplification test such as RT-PCR. Serological testing can also be done to diagnose COVID-19 disease, whereas viral sequencing and COVID tests from Roche are the another diagnostic tests to diagnose COVID-19. Muscle swab test. In this test, a healthcare provider uses a long swab to take a muscle sample. The sample is then sent to a lab for testing. The last test is antibodies test through finger prick. The test checks for protective antibodies in a finger prick of blood, revealing whether a patient has ever been exposed to the coronavirus and or may have some immunity. That's an important difference from tongue tests, which look for fragments of coronavirus genes that indicate an ongoing infections. It may show that it is safe for people who are immune to the coronavirus to leave their homes and rejoin the workplaces. Also, antibody testing could provide a better idea of how widespread coronavirus infection is in the population and improve calculation of the death rate. So let's have a look on case definition of COVID-19 disease. So how can we define the suspected cases, probable case, and confirmed case? So case A of suspected cases are a patient with acute respiratory illness, that is fever, at least one sign and symptom of respiratory disease like cough, shortness of breath, and with no other etiology that fully explain the clinical presentation and a history of travel to or residence of country or area or a territory reporting Local transmission of COVID-19 disease during the 14 days prior to symptom onset, or case B of suspected cases are a patient with any acute respiratory illness and having been in contact with a confirmed or probable COVID-19 case in the last 14 days prior to the onset of symptoms. Case C of suspected case is a patient with severe acute respiratory infection, fever, at least one sign and symptom of respiratory disease like cough and shortness of breath, and requiring hospitalization and with no other etiology that fully explain the clinical presentation. The probable case of COVID-19 is a person or a suspect case for whom testing of COVID-19 is inconclusive, whereas confirmed cases are when persons with laboratory confirmation of COVID-19 infection, irrespective of clinical signs and symptoms. So the question which comes into our mind is who should be tested for COVID-19? The CDC has identified those who are at the highest priority for testing include the first case is hospitalized patient who shows symptoms. Healthcare professionals who within 14 days of symptom onset had close contact with the laboratory confirmed COVID cases, whereas WHO has been urging countries to test every suspected case. So, how does transmission of COVID-19 virus occur? COVID-19 is not airborne. The virus that causes COVID-19 is mainly transmitted through droplets generated when an infected person coughs, sneezes, and speaks. The droplets are too heavy to hang in the air. They quickly fall on floors or surfaces to settle. You can be infected by breathing in the virus if you are within 1 meter of a person who has COVID-19 or by touching a contaminated surface and then touching your eyes, nose, or mouth before washing your hands. To protect yourself, keep at least 1 meter distance from others and distant surfaces that are touched frequently. Regularly clean your hands thoroughly and avoid touching your eyes, mouth, and nose. So, what are the complications associated with COVID-19 disease? In advanced cases, the patients can have very serious complications such as severe pneumonia and renal failure, that is kidney failure, which can lead to death. The virus can cause pneumonia, which is an infection causing the air sacs in the lungs to fill with fluid. It has also been linked to bronchitis, which is an inflammation of airways in the lungs, whereas elderly people and people who already have a medical condition such as heart disease or diabetes are the most at risk of suffering from complications. People with weakened immune systems are also at high risk, and they include people with HIV, cancer, and people who do not get enough nutrition. So, how it transmits between people? When someone who has COVID-19 coughs or exhale, they release droplets of infected fluid. Most of these droplets fall on nearby surfaces and objects such as desks, tables, or telephones. People could catch COVID-19 by touching contaminated surfaces or objects, and then people touch their eyes, nose, and mouth. An infected person can have contaminated hands, face, clothes, and physical contact with such person can transmit the disease. Let's talk about the treatment of COVID-19 disease. Currently, there is no approved antiviral medication for the infection. Treatment is directed at relieving symptoms, which may include relieving pain and cough. These supportive medical care is provided to help relieve the acuteness of the symptoms and control complications. People or patients who are COVID positive must be put on ventilators as they experience severe respiratory distress. Bed rest and fluid intake are also recommended. So, what are the safety recommendations to the society? Avoid handshaking, keep social distancing and physical distancing. Maintain at least 1 meter distance between you and anyone who is coughing or sneezing. Kindly stay at home. Avoid social gatherings. Wash your hands with soap and water frequently for at least 20 seconds to kill any virus on your hands. Use chemical sanitizers. Use alcohol as sanitizer. Quarantine yourself or quarantining the infected and suspected persons. Washing clothes, exposing to them to the sunshine, and lockdown. So, what are the reasons of high fatality? The world didn't expect the virus would spread across the world at this level. So, the first reason is unpreparedness for the pandemic. Lack of facilities and supplies are the other reason to high fatality. Lack of facilities and supply. So many doctors and nurses who know how to protect themselves were sacrificed due to lack of protective supplies and the rush in the treatment processes. Another reason is disobedience of the community to containment measure of government. The high surge of patients beyond the capacity of the health facilities is the other reason for high fatality. So, what are the methods for prevention? Avoid handshaking. A. Social distancing. Make sure you follow good respiratory hygiene. Avoid touching your mouth, nose, and eyes as hands touch many surfaces and can pick up viruses. Wash your hands frequently with soap and water or clean your hands with alcohol based sanitizers. Cook well meat products and eggs. Stay home. If you have fever, cough, and difficulty breathing, then seek medical attention. For healthcare professionals, wearing medical masks or respirators, especially N95 or FFP2, is another preventive method. The healthcare professionals must wear protective goggles, face shields, gloves. They can also wear aprons and gowns to prevent COVID-19 infection. Kindly subscribe RPIIT YouTube channel for more videos and thanks for watching.